Swallowing disorders, collectively known as dysphagia, can result from a variety of causes and can significantly impact quality of life. Advanced treatments for dysphagia in both children and adults focus on addressing the underlying causes, improving swallowing function, and ensuring safe and adequate nutrition. Here are some of the advanced treatments currently available. 1. Swallowing therapy. 1. Speech and language therapy. Specialized therapists work with patients to improve muscle strength and coordination required for swallowing. 1. Techniques include exercises for tongue and throat muscles, strategies for safer swallowing, and diet modifications. 2. Neuromuscular electrical stimulation, NMES. This involves the use of electrical currents to stimulate swallowing muscles, enhancing strength and coordination. 2. Medical interventions. 1. Medications. Depending on the underlying cause, medications can help manage symptoms. 1. For example, proton pump inhibitors, PPIs, for reflux-related dysphagia, or botulinum toxin injections for muscle spasticity. 2. Treatment of underlying conditions, addressing the root cause of dysphagia, such as treating esophageal strictures, removing tumors, or managing neurological conditions. 3. Surgical interventions. 1. Dilation procedures. Esophageal dilation can help open a narrowed esophagus, often performed endoscopically. 2. Myotomy. Surgical cutting of the muscles at the lower esophageal sphincter, LES, can help in conditions like achalasia where the LES fails to relax. 3. Fundoplication. Surgery to strengthen the LES, often used in cases of gastroesophageal reflux disease, GERD. 4. Advanced endoscopic procedures. 1. Peroral endoscopic myotomy, POEM, a minimally invasive procedure used to treat achalasia, where an endoscope is used to cut the muscles at the LES to facilitate easier swallowing. 2. Esophageal stenting, inserting a stent to keep the esophagus open in cases of strictures or tumors. 5. Dietary modifications and nutritional support. 1. Texture-modified diets, tailoring food textures to the patient's ability to swallow safely, including pureed, minced, or thickened liquids. 2. Enteral feeding, for patients who cannot swallow safely, feeding tubes such as nasogastric, NG, tubes or percutaneous endoscopic gastrostomy, PEG, tubes provide necessary nutrition. 6. Technological aids. 1. Swallowing rehabilitation devices. Devices like the Iowa Oral Performance Instrument, IOPI, help measure and improve tongue strength and endurance. 2. Virtual reality, VR, and biofeedback, emerging technologies providing real-time feedback and virtual environments to practice and enhance swallowing skills. 7. Innovative therapies. 1. Stem cell therapy, investigational treatments involving the use of stem cells to repair and regenerate damaged tissues involved in swallowing. 2. Regenerative medicine, utilizing growth factors and other biological agents to enhance tissue healing and function. 8. Pediatric considerations. 1. Early intervention programs. For children with developmental delays or congenital disorders, early intervention programs involving multidisciplinary teams can help improve swallowing function. 2. Adaptive feeding techniques. Techniques and tools designed specifically for children, such as specialized bottles and utensils, can facilitate safer swallowing. 9. Holistic and multidisciplinary approaches. 1. Comprehensive care teams, involving gastroenterologists, otolaryngologists, neurologists, dietitians, and speech therapists to provide a well-rounded treatment plan. 2. Patient and family education, training caregivers and families on safe feeding practices and recognizing signs of dysphagia. Research and development. Ongoing research into the causes and treatments of dysphagia continues to bring new insights and innovations, aiming to improve outcomes and quality of life for both children and adults with swallowing disorders.